Hi guys, I'm Dr. Tara Tobias. I want to welcome you all back to my channel. In today's home exercise tutorial, we are going to go over how to correct a leg that rotates out. So I get this question / comment a lot. What's causing my leg to do that? So I thought it was a great opportunity to create a little mini series on how to fix that. But real quick before we get started, if you're new to my channel and you haven't yet hit subscribe, please go ahead and click that subscribe button below and turn on that notification bell so that you will be the first to know when I upload new videos. So I originally just made one video, but I realized it was a lot of information to pack into one video, and I really like the idea when it comes to exercises that involve neuroplasticity or retraining the brain to break things down into small chunks so that you have time to really incorporate one set of exercises or one movement and really give the best opportunity for that brain to start reorganizing around that movement or that particular exercise before adding on to it. So that being said, this is a two-part series on how to fix a leg that rotates out when you walk. So today in part one, what we're gonna do is I'm gonna go over what some of the main reasons are that might cause this to happen, and then go over the first set of activities that I feel are important to help correct it. And then in part two, which will come out next week, I will go over the remainder of the exercises. So I really encourage all of you at the end of today's video to really just focus on this first little nugget for a week, and then it'll make the next section make a lot more sense, and hopefully it'll be a little bit easier to add those exercises on. So all that being said, let's go ahead and get started. So why does this happen? If you're someone who, when you're sitting, your leg flops out to the side, or even more importantly, when you're walking, you notice that that knee goes out to the side. So there are a few reasons why I think this happens. Now, this is not all inclusive, and you might talk to different therapists and they might have a little bit of a different perspective on this. In my experience, I've identified a few reasons why I think this happens. One is it is part of an abnormal movement pattern. So you've heard me talk a lot about this in other videos, but there are two main what we call synergy patterns that happen after a stroke. They're also sometimes referred to as primitive patterns. There's something that are kind of built into the hardwire of our brain. And what they are basically when multiple joints move together, so in synergy. And two main ones are a flexor synergy and an extensor synergy. So with a flexor synergy pattern, when you bring the hip up, it's also going to want to abduct or go out to the side and externally rotate. At the same time, the knee is going to flex and the ankle is going to dorsiflex. That is the flexor synergy pattern. So it's hip flexion, abduction, and external rotation all at the same time, knee flexion and ankle dorsiflexion, and all of that occurs together. So if you have strong synergy patterns, if you try and do one of those movements that I just described, they're all going to happen. So this can be beneficial. I've talked about that in the foot drop video. If you're trying to regain ankle dorsiflexion, flexing the hip and flexing the knee might help that. So that's kind of using one of those primitive synergy patterns to help facilitate that. But then there are also times where these synergy patterns will really interfere with normal movement. And one of those very important normal daily activities that it might interfere with is walking. So when you go to bring the foot forward or bring the leg forward, so when you go to flex the hip, it's going to externally rotate and abduct out to the side. So that's one reason why you might see your leg flop out to the side. The other reason is along those same lines is if you have a lot of spasticity. So synergy patterns and spasticity, if you have a strong synergy pattern, you most likely will have some spasticity, so they kind of go together, is if you have ankle plantar flexion spasticity. So I'll put the link for that right here where I go into that and describe that in a little bit more detail. But with that ankle spasticity pattern, and what I talk about is the gastrocnemius, the soleus, and the posterior tibialis are all overactive. And so those three muscles point the foot down and roll the foot. And again, if you want to learn more about that, I'll have that link in the description below. So when that foot rolls to the outside, the leg sits on top of the foot, and so the leg will also roll to the outside. So that's another reason why you might see the knee go out to the side, is that your foot is not flat on the ground and that you're rolled to the outside. And usually that's because of plantar flexion spasticity. And another really common reason that probably has nothing to do with like an abnormal movement pattern, but it is extremely common, is when you are in the hospital, you're laying in a hospital bed. If you were in the hospital for a long time, you have sheets and blankets on your legs. Usually that leg rests and it just flops out to the side, especially in the really early stages where you have no movement. And then also if you're someone who uses a wheelchair primarily and you have no movement, there's a tendency for that leg, the involved leg, to just flop out to the side. So if you're in those positions for a long time, days, weeks, months, years, now the muscles that pull the leg out in that direction, they've all shortened, kind of like they've accommodated for that new position of your leg. So all those muscles that pull the leg out to the side and rotate it out are just tight. And then one last reason why when you're walking, you might see your leg fling out to the side or the knee fly out to the side is because of just weakness. So a lot of times this will go along with a lot of momentum, so a lot of trunk momentum. But when you rotate the leg out, just the way that the leg bone is shaped and how it sits in that ball and socket joint, when you rotate it out, it technically shortens the leg. So because of the way that it's shaped and the way it sits in the cup, when you rotate it out, it actually shortens the leg. So some people just learn this. It's not something someone told them. It was just kind of our bodies and our brains are just really adaptable, and you just learned how to do that to shorten that leg to help you swing it through so that it wouldn't get stuck on the ground. And then along with that, to get the leg through with the least amount of resistance and to use a little bit of momentum, a lot of people swing it out to the side, or we call that circumduction. So if you do that enough, your knee is just going to naturally look like it's going out to the side when you're walking. So those are the main reasons that I see as to why it happens. Now, the reason I went into that and the reason that's so important is because it's going to help you understand how we're going to fix it, or the progression that I'm going to go through today to fix this problem. There are two key things that I do consistently, regardless of what movement impairment I am working on with a patient or what exercise program I'm giving them specific to their movement problem. And that is, one, getting the range of motion or the movement. You have to make sure that the muscles and everything are long enough to allow you to do the movement that you want to do. And then two is actual motor control or movement recovery activities. So those are the two big picture things. And then also a lot of times with stroke or any neurologic injury, I always incorporate something in standing. It's functional, it's purposeful. And if you read anything about neuroplasticity, purposeful movement is the best way to get that brain to engage and try and form those new connections. So let's go back to the range of motion, or getting that range of motion. A lot of that's going to come down to stretching, whether the muscles are tight because of some of the positions that I mentioned as far as being in bed, or you've just been doing this for so long. The muscles that pull the leg out and rotate the hip out are going to be extremely tight. So we're going to go back and stretch those muscles out. So we're going to move opposite to that. So there's a couple of positions I like to do this. The first one is laying down. So you're just going to start laying down with the involved leg. That's the one with the yellow duct tape. You're with the involved leg bent up. You're going to have the foot slightly out to the side, and you're just going to bring that knee down towards the other knee. So, and just hold it. So you're going to bring that knee down and in and just hold it. So stretches, you always want to hold for at least 30 seconds. There's no harm in holding it for a minute. Muscles are like rubber bands, and you don't want to do it fast because then you're going to get more resistance, or you're going to get it to spring back. So you want to make sure you do it slow. And then because they're like rubber bands, as soon as you let go, it's going to spring back. The best way to get like what they call like permanent lengthening where that elastic component's not going to naturally spring back, but you're actually going to lengthen the rubber band, is to hold it for at least 30 seconds. Now in this next one, and if you can't bring that leg in, you might want to try this method instead. You're going to start with that same position with the foot slightly out to the side, and now you're going to cross the other leg over your uninvolved leg over your involved leg, and you're just going to pull it down in that same direction. And again, you just want to hold this position for 30 seconds to a minute. And then the other position I really like for this stretch is in sitting. And anyone who's really spastic or it's super duper tight, I encourage a lot of my patients to just hold this position whenever you're sitting, whether you're watching television, just to always get that good stretch. But you're gonna sit and cross your uninvolved leg over your involved leg. That alone, just sitting in that position with the legs crossed like that, is going to give you a really good stretch. But what it's also going to do is it actually gives you weight bearing through that leg as well. So you're getting some pressure down through that foot. And then if you wanted to deepen the stretch, you can just bend forward and cross that arm, cross your uninvolved arm over and try and reach for the outside of the ankle. And then come back up. Make sure you are really far back in the chair. You very easily could fall out of the chair when you bend over in this position, because the only foot you have on the ground is your weaker leg. So really make sure if you do this that you are not sitting on the edge of the seat, that you're all the way back up to the back of the chair. And that is it. I hope you all enjoyed that. I hope it makes a lot more sense now why I'm selecting the exercises that I'm selecting. Again, work on this little first chunk, these stretches, for a week. It'll make the next section, which will come out next week, it'll make those activities a little bit easier to add on. If you liked this video, please go ahead and give it a thumbs up. If you haven't yet subscribed, go ahead and hit that subscribe button. Click on that notification bell so you'll be the first to know when I upload new videos. Leave comments. I love your comments. I respond to most of them. And that being said, if you have questions or comments, the best place to put them is in the comments section right here. I can guarantee you that they will be answered if they're here. I know in the past I've said email me, put stuff on Facebook. That's still okay, but really this is the place where they will where you can be guaranteed that I will see them and I will respond to them. If you haven't signed up for my newsletter yet, please click on the link in the description below, where I send out emails on how to help you stay motivated and stay on track with your rehab goals. If you haven't joined my Facebook group, that link is also in the description below. Please go ahead and click on that. It's a closed group where we just encourage each other, and I'm there to kind of help you all along in your rehab journey. And now, regardless of where you're at in the rehab journey, whether you're 1 week in, 2 weeks in, or 10 years in, keep your eyes focused on just getting a little bit better each day. You may not reach your goals tomorrow or next week or even next month, but stopping or slowing down should not be an option. I promise you that if you put in the work every single day and focus on the little improvements that you're making each day, you will look back a year from now and really be able to appreciate just how far you've come. And that is it. That's all I have for today. Thank you all for being here. Thank you for making it to the end of this video. And until next time, you all have a great day.